is Brooke Massengale, and today I'm going to be doing trach suctioning and trach care. I am going to follow all my agency policies and procedures. I'm going to perform good hand hygiene, body mechanics, safety and privacy of my patient, and all other protocols. I am going to obtain my catheter suction kit. I have already opened it and folded the top underneath, and I have pulled my sterile gloves out. And so what I'm going to do is I'm going to move this. Can't touch it inside of there because I'm not sterile yet. I'm going to unscrew not unscrew, but loosen my cap on my saline over here a little bit. And I'm going to go ahead and put on my sterile gloves. Underneath the flaps, open it up. I'm gonna pinch, step away, hands above my waist. And I'm gonna take 2 fingers, go underneath the other glove, step away, palms up, hands above my waist. Okay, so now I'm sterile. I'm going to take and I've got both of my hands are sterile, so I can take my catheter, and it's already wrapped up, so I'm just going to put it here in my dominant hand. And then I'm going to go out and around, grab my saline, filling up my container with saline. Okay, and then obviously before I do all of this, I'm going to make sure that my suction is working properly, that it is set to where it needs to be. So now that I have touched my hose, I am no longer sterile on this hand, and this is my sterile hand. So I am going to make sure that it's set properly. I'm going to be 100 to 150 for adults, 100 to 120 for children, and 50 to 95 for infants. So I'm going to take and I'm going to attach my catheter. And then I want to hold this taut like this, making sure that it's not dragging or anything like that, because this is a sterile procedure. So I'm going to test to make sure that my suction works. So I'm going to occlude my hip hole right here and suck out some saline. And then I'm going to go ahead with my trach suctioning. So I'm going to, again, I'm going to hold it taut, and then I am going to put it down in until I meet resistance or to the prescribed amount. So again, holding it up, I'm going to not have the suction on at this point, but then after I have met resistance or to the prescribed amount, I'm going to hold my suction on. Pulling back with my left hand and twirling with my right hand, and I want each pass to be no greater than 15 seconds, and then I want to not be suctioning for greater than 5 minutes altogether, and if necessary, giving them 30 seconds in between each pass to recover. And then, so after I've done a pass, I'm going to come back, I'm going to suck some saline through, and then I'll go again. And if I need to hyperoxygenate them, I will have a partner with me, somebody with me, usually that is on standby to help hyperoxygenate them, so that way I'm not getting my sterile hands dirty while doing this. Okay, so now I'm going to be doing my sterile procedure for my wound. So I've already done my irrigation and everything. I just want to make sure that I'm doing my sterile procedure. So I've obtained my wound care kit, my saline over here. So I'm going to go ahead and open away from me, away from the patient, toward me. Maybe if I can get it open. Then I'm going to grab over here, up underneath, or the small 1/4 inch around the edges is also contaminated as well, so you can use that. pinch, step away. Okay, that one's on. 2 fingers. Palms up, step away. Okay. And since I don't need that, I'm gonna plug it, get rid of it, and then I can move this from the inside wherever I need to. So I'm gonna take shiny side down. I'm gonna put my drape onto my patient, making sure I don't touch my patient and that the drape doesn't touch the wound. And then I can grab the middle here. I can move this around as needed. So I'm not gonna need that yet. Not gonna need these yet. Not gonna need that yet. I'm gonna turn it so that way I am not reaching over. Not gonna need that yet. And then I wanna make sure that I'm counting my gauze, and then I'm keeping one out to go over the wound when I go to address it. So there's 1. So 2, 3, 4, 5, 6, 7, 8, and 9. So at this point, I can not turn my back on my sterile field. I can grab my saline. So now this hand is dirty. So I can unscrew and come out and around, pour some saline in there. And then I want to make sure that when I'm doing this that I am, before I place these in the wound, that I am, this is still my clean hand, so I am scrunching them out. So I can take my clean hand and I can put, let's say, my tweezers into my dirty hand, but I'm not touching the tip, so I can put them into my dirty hand. So I can squeeze this out, my tweezers, grab my Q-tip, and then I can place, making sure I'm not touching the wound with any of my supplies, and that I'm packing it. It's hard to do when they're dry, so it's sticking to my Q-tip. There we go. So pack, and I'll grab another one. I've already squeezed. If I want to, I can squeeze them out and place them into this one. So squeeze them out, grab them, place them, pack them down. You don't want this to be too tight. Pack it down. And I'm going to use as many as I need. Sometimes I won't need all of them. So after I've got all of the packing done, I can drop these, drop this, and then I can place one of my dry pads over the top. Again, making sure that I'm not touching it because I'm still sterile, so I haven't touched it. And then I can take my ABD and place it over the top. And once that's placed, it is now a clean procedure. It is no longer a sterile procedure. Just gonna move that a little bit, it was in my way. Okay, but you wanna leave it there. You don't want any drainage or anything to get on it. So my ABD's on, that means that I am now in a clean procedure and no longer a sterile procedure. I'm gonna grab my scissors. Put that on here. I'm gonna cut this. Actually, I'm gonna do my Montgomery straps first. So I'll take my tape. Oh, these stick horrible to this. Okay. And then I'm gonna fold about halfway down. Fold down again. And cut a slit in there. And that's gonna be, and I'm gonna pull it back up. And that's gonna be my Montgomery strap. So I'm gonna be able to place this on this side of my dressing, and then I'm going to be able to take, I'll make another one. Okay. Okay. And then I can take this, cut myself a strip. And secure it through my Montgomery straps. When you tie this off, you want to make sure that it is not too tight, or that you don't tie a big knot in it, because you don't want your patient laying on that, depending upon where their wound is. So this makes for super easy removal of your dressing to change it. So make sure it's secure, but you don't want a big knot. And again, this is going to make sure that you have your dressing secured, but also it's going to make for easy removal of like changing your dressing pad, things like that. And that is wound care. That is my sterile procedure for wound care.